Hi, my name is Dr. Victoria Manning, and today I'm going to be demonstrating how we can perform a silhouette soft lift on our patient Mitch, who's very kindly volunteered for us today. Mitch, can you explain exactly the areas that you would like treated today?
Definitely. Oh gosh, I'm in late 40s, and here, when I sort of have my face just sort of like that, it sort of just looks like I'm upset or I'm sad, and it's all this jowly bits that's really sort of hung down. I just want it lifted and more youthfulness going up again.
What we're going to do, Mitch, is we're going to use silhouette soft threads to try and redefine your jawline and try and give you some lift to your pre-jowl sulcus, which is this area here that you don't like, and this heaviness coming down from your mouth. And we're going to do this by two techniques. We're going to do a linear technique along the jaw, which will just put that definition back, and then we're going to do a U technique, literally just to lift that tissue there, okay?
Yeah.
So what we're going to do is put some anaesthetic at the entry and exit points to make it completely painless, and we'll be inserting the threads in a layer that shouldn't be painful at all. But if it is uncomfortable, you do need to tell me, okay? The only potential side effects that you could see, like we discussed earlier, is you might get a little bit of skin puckering as we're pulling the tissues up over the cones, all right? That will resolve within 2 to 3 weeks, okay? And you might, obviously, because we're injecting, you might have a bruise at the entry or exit points, but we will try and minimise that, okay? Are there any questions you'd like before we get started?
Let's go.
Okay, so as you can see, we've already marked up Mitch's face, so we're going to put a linear thread up into her jawline to define this jaw, and we're going to do a U technique here. To save time, I've also anaesthetised the entry and exit points, so we're going to have 2 exit points here for the U and an exit point here, and coming up into the hairline up here. How does that all feel, Mitch? Okay?
Yeah, absolutely fine.
Brilliant. Are you ready to get started?
Please.
So Mitch, I'm just going to check that your skin is numb. It's blanched up really nicely, which is great. Can you feel that at all?
No.
No. Okay. So what I'm going to do now is just check the threads. Do you want to see what's going in? Yeah? You don't have to. So that you can see they're the cones. Let me just show the camera as well. So they are the cones that will be going into Mitch's face. So I'm just going to tighten them slightly. All right? And what I'm going to do now, Mitch, is I'm just going to make a little entry hole to put the thread into your face. If you can turn and look at the door for me, okay? That's just face over there. That's perfect. You're comfy like that.
Yeah.
If you can breathe.
Okay.
Okay, so you're going to feel a little bit of pushing, Mitch, okay? Nothing more. So I'm just going to make a little entry hole into the tissue, okay? So I can put the thread in. All right, so far so good?
Yeah, I can't feel it.
Good. If you can feel any discomfort, please tell me, okay? Just going to put that thread in there out of the way. Okay. Okay, so we're in the tissue, and we're just going to be going along. You all right, Mitch?
Yeah.
Okay, you're just going to feel a little bit of pushing. Okay, how does that feel? All right.
Yeah, I can't
You're just
feel
going to
it.
feel a little bit of pressure. Okay, as I come out the tissue, out of the exit point. So I'm just coming out where it's nice and white, where the skin's all blanched. So you're just going to feel a little bit of pressure, Mitch, okay? And as the thread pops out the other end. Okay, I just need to make sure I'm in the right plane. That's perfect. Okay. So you're just going to feel a little bit of a weird sensation as the thread goes into the tissue, and you'll feel a little bit of sort of popping, and that's as the cones are going through into the tissue. So you can see now the cones are actually going into the tissue as I'm putting gentle traction while they're going in. So that's beautiful. Okay, so that's the first part of the threading. So what I'm going to do now is just going to put the anchoring thread in now. So we're just going to go in the same hole. There we go, actually in the hole, that's perfect. And it's exactly the same, Mitch, okay? You just feel a little bit of pushing. Please tell me if you feel any discomfort at all.
No.
Because the plane that I'm in, we shouldn't have any nerve endings, so it should be quite comfortable. Okay. So you're going to feel that funny pushing sensation again as we bring the thread out, okay?
Yeah.
Perfect. All right?
Yes.
So there we go, there's the anchoring thread in. again, you're just going to feel that funny traction of those threads going into the skin. It feels quite weird, doesn't it?
Yeah.
Just going to get those last cones in. So now you can see we're just doing the bottom part of the U. So we're just feeding it, the needle through the tissues to our end point here. Just following the line. How are we feeling, Mitch? All right?
Yeah, fine.
Okay. Nearly there. This one doesn't feel as quite as uncomfortable as the other one because you're not going over the bone. I think the other one is a bit of an owie, isn't it?
Just a bit bee stingy.
There we go. So this one's nearly through. There we go. So we're just going to take this thread out. Where are we? There we go. Just check. Just run your tongue through the inside of your mouth at all. You can't feel anything, Mitch.
No.
Nothing.
No.
Okay. That's fine. Okay, and we're just going to feed these cones through, just like we did on the other side. So what I've done is I've just made a tunnel, and I'm now going to pull the thread through into the U. There we go, most of the cones are through, one left to go, perfect. So what's going to happen now, exactly the same as the other side, I'm going to have the cones coming down the face. We're now going to tighten the threads a little bit and then finish off on the other side. So we're just going to put a little bit of up traction and literally, do you feel those popping over? And literally, there's tightens as we go. And then we'll just tighten the jawline, just pushing the tissue just gently over the cones. There we go. Right, Mitch, how are you feeling?
Yeah, good.
Wasn't too traumatic for you.
No, it's fine.
What we're going to do now is we're not going to send you out with your little whiskers, so we're going to chop those off, okay? The white little blobs that you've got all over your face, that will just settle down over the next hour or so. That was just from the adrenaline, okay? So that will go. And if you've got any ice packs at home, because you're going to be a little bit sore there.
Okay.
What did that whisker? Yeah. I won't send you out with any whiskers. Okay, we'll just chop this one off here. Okay, and just to the entry holes, I'm just going to put some antibiotic cream on and just put a dressing over the top. Okay. Okay, as you can see, we now have a much more defined jawline. Would you like to see, Mitch?
Yes, please.
Oh, there's a mirror. Okay.
Oh my god. Wow.
What do you think?
Really tighter, yeah. Oh my god, yeah.
Your face will be a little bit sore for a couple of days. Just put some antibiotic cream under the tape, so if you can just keep that on for 24 hours.
Okay.
Right? And then you can take it off. Don't put any skin products on your skin today. If you have to wash your face, just use water. And tomorrow you should be able to go back to your normal skincare regime. All right?
Okay.
Any concerns, let us know.